Hello again everybody, Jeremy Latham here again. This is one of my top tips videos. I've just come home from clinic, I'm in front of the piano. That's one of the things I do to try and unwind after a hard day's work. I've been struggling for years to play the piano, despite having lessons every week, but despite the trials and tribulations of it, I do actually love playing. One of the great things about doing a clinic is that you get to meet so many different patients. I saw a lady today and she's really struggling with hip pain but doesn't have arthritis of the hip, and she's delighted to hear that she doesn't need a hip replacement. And one of the things I can do is steer people into the right direction so that they don't unnecessarily have surgery and just give them a diagnosis. That's often half the battle. Anyway, one of the things that people worry about most about recovering from hip surgery is how they're going to cope at home. A lot of my patients live on their own and their families are scattered far and wide. How are they going to cope when they leave hospital? We keep patients in hospital for such a short time these days, often only 3 or 4 nights at a time, and they worry, and I worry as well, about how I'm going to cope in a house where everything is quite difficult to manage. So top tips today are, the best thing you can do to try and overcome the anxiety about going home is plan as far ahead as possible. Speak to your friends, your family, your neighbours. Ask them to help out if they can. If you have access to carers, then all well and good, but not everybody does, and care is expensive, and that's on top of what you might be paying to have a private hip replacement. So the more you can get in place, the better. Frozen meals, think about having a food delivery service. All these things are easily available. When you do get home, the most important thing I can stress to you is have lots of rest. Coming into hospital is stressful, having surgery is stressful, and will tire you out. The most important thing you can do is to plan a rest at least twice a day. Go and lie in your bed for at least an hour twice a day. Don't sit for more than half an hour. If you sit for too long, you'll seize up. It's sore and stiff when you get up again, and you undo all the good work you've done earlier in the day. You'll soon get into a rhythm after surgery and when you get home of getting up in the morning, washing and dressing, having some breakfast, doing some exercises, maybe have a short stroll in the garden or around the house, around the block. Come home, repeat that cycle. So rinse and repeat. And then before lunch, factor in an hour lying in bed, just getting your bearings again, relaxing and maybe having a snooze. Have some lunch, repeat that cycle, have an early night. After 2 or 3 weeks or so, you'll find the need for rest becomes far less. Surgery, as I've mentioned before, is this complex interaction of psychological and physical factors, and you can't get away from the fact that surgery is stressful. You're surrendering yourself to a system which is alien to you. It's my bread and butter, it's my office, but for you, it's quite a stressful thing to hand yourself over into a system that you don't really understand and fully comprehend. Our job as surgeon, the anaesthetist, the nurses, the physiotherapist is to take you through that process safely and efficiently. So surrender to that process. The more you can do that, the quicker you'll get better. I don't mind people driving it around a month or so. I'm far less concerned now about some of the precautions we use, so I don't mind you lying on either side pretty much as soon as you get home. Obviously the side that's been operated on will be sore, so you might want to avoid that, but you'll find ways around lying on one side or the other. Speak to the physiotherapist, call me for advice if you need some. I hope that's been helpful. I'll speak to you again soon for more top tips for hips. Thanks for watching.